Hello and welcome to Cadabam's Insights. One more series, one more interesting topic with one more very interesting personality today. Today, we will talk about rehabilitation in the context of substance use or alcohol and drug abuse. We have one of the most eminent psychiatric social workers, Dr. Shreedevi. She finished her master in psychiatric social work from Mangalore and then went on to do her MPhil from one of the most premier institutes of our country, which is NIMHANS. After completing her PhD, she had her experience or work in various institutions in Bangalore, and then she went back to her parent institute, NIMHANS, where she's working as a consultant, psychiatric social worker, and assistant professor, training hundreds of people so that they can come back to society and help millions. A warm welcome, Dr. Shreedevi, and meeting you after a long time. How are you?
Thank you. Thank you for having me. I'm good. Thank you.
Thank you so much for making time and accepting to be part of this conversation. Common, generally when we talk about social work, he's a social worker means, the perception is that this individual is doing some charity, some work. But when I talk to you, it's a fantastic field, specialty where you are doing so wonderful work, with patients. What is this social work? When you're talking about specifically psychiatric social work, what does this entail?
Yeah. It's really a privilege to talk about my profession and also in a forum which is really, really appreciating this profession. I know your association with mental health professionals and the amount of people who have been working with you is enormous, and it's really a privilege to talk about it.
Thank you. Thank you.
So, psychiatric social work is a profession which is completely a professional course which is generally done after your post-graduation. So, and you have many subjects which are connecting with psychiatry, psychology, and social work. So it's an amalgamation of all these disciplines. Practically, when we see in the community or in the society, voluntary work sometimes is known as social work.
Yes.
Or some specific personalities, when they do certain work, it is known as social work. So, but
many philanthropists, when they are doing philanthropy work, what do you? Oh, she or he is a very good social worker. They talk about it. So there is a very good positive connotation. But talking to you, there is a lot of medical connotation associated with. Yes, please.
Absolutely. It is a professional course because we also undergo rigorous training and practical and clinical experiences on the field. So this brings us to call ourselves a psychiatric social work in a more privileged way. All will not be having similar training, but some of the Institute of National Importance do conduct MPhil and PhDs in this field. So
as social worker, what do you do in a medical setting? Like be it NIMHANS or general hospitals. What is your role actually?
Okay. First and foremost, we as social workers are part of a multidisciplinary team. Wherever there is a concept of multidisciplinary team, we are part of it. So from the intake of a patient or from the time patients get screened to a system of health, we are associated with them, be it in terms of assessing their financial background, assessing their capacity to handle or being hospitalized, and how the family also has to prepare themselves to be with the patient. And then the treatment modalities continue. And while the treatment modalities continue, we are also part of the treating team where the psychological and social awareness intervention and specific intervention whenever required is being provided. Then when the patient is ready for discharge, then the social workers are the one who continue as aftercare intervention specialist, and the long-term care also is done by social workers. And then finally, if there is a rehabilitation or if there is a community integration, so the whole journey of a patient and the family is associated with psychiatric social work team. But a patient who's there in other setting, the work culture is different, which I may explain later. But when a patient whom we call as a patient or a client, when he or she is coming, the initial distress because of biological reasons has been taken care by the psychiatrist. And then once they are ready to talk, once they are ready to involve in other intervention-based modalities, then psychiatric social worker pitches in. It includes the individual assessment, like what are the reasons for the person to come? What are the reasons for the person to reach to this level which required an intervention and which generally has a psychological and social connotations? It may be a family, it may be a peer pressure, it may be the environment, it may be the distress, it may be the financial condition, it may be the loss of a event, person, or any relationship issues, or just the expectancy out of alcohol or other substances because of the personality. I'm more anxious. I have certain distress. So this kind of substances help me to come back or get back. So even such misconceptions. So there may be very many reasons which are mostly associated with social and psychological factors. So that is why assessing all these factors becomes an important factor for us. So when we know what is the reason, then the intervention is easy. Where it's not easy as in that the pathway is easy.
We know exactly what to do.
Yes.
So a person who has addiction, when they are with psychiatric social worker like you, what are the domains, what are the areas that you explore, and how do you look at a patient? We had discussion about alcohol addiction with one of the psychiatrists, and psychiatrists have a perspective which is very, of course there is biopsychosocial, but biological, where the involvement of the brain, the neurotransmitters, the centers of the brain that is there. So from a psychiatric social worker context, when you see an addiction patient, what are all the things that you explore and how do you explore?
Yeah. As I mentioned, any substance use is a vulnerability of an individual, but it spreads across different segments of his life. If it was a child, it was in young age, then there may be many reasons for which the person would have gotten into this particular problem. But when the person comes to us, we won't just see the person as one person, one individual. So we have to see the person as a whole. So which includes, as I said, family and the community environment and other factors. So first assessment will give us a certain understanding of what kind of person, what kind of environment, what kind of family background. So these things will be taken care by psychosocial assessment. We have a format to follow, and we also have a lot of open-ended questions where we can get some interpretation from the patient and family side. So once the information collected from the patient, we also go to the family, because family's perspective will be totally different. So there are many times mishandling or managing in a different way, or understanding itself in a different way would have led to the substance use to continue.
As I understand, your perspective is there is a person with addiction, and you don't look at it as an individual. You look at it in the context of him being a son or a husband or a member of a society or a community, what is the impact of this various social structures, be it impact of a particular type of a family which might push an individual to take substance or alcohol, or for that matter the cultural context, so what are those? Can you please help us go through that?
Yeah. So when we see any patient, we understand them in different perspective. One is individual. So individual includes the how much of genetic vulnerability is present, which already would have been discussed. So how much of environmental factors. So when it comes to individual itself, the amount of peer pressure, the amount of expectancy out of such substance, like I said. So all these factors are covered. So but when it comes to family, there are many layers to the family. So it may be a family where the substance use is not at all a problem. So there is a high acceptance about this use in the family system. So this person may not have found it as harmful at all. So the understanding of substance itself is a reason what we observe. And I would like to mention here that the experience as well as what studies say about this. So I would be talking from both the perspectives.
Sure.
So then we also know that many families where alcohol itself is a problem, there is a father or there is a sibling or there is a family member who's already addicted or who's already a problematic user. There is a high chance of modeling, or there is a high chance of going for a substance use at the later stage, which is been proven in a study across the globe. So the other factor that we have observed is the person's relationship with the family members, which is nothing to do with substance use initially, but the relationship itself, the conflicts that happen, the distress that take place, maybe because of the substance use or maybe because of the different personalities of the people in the family system, or the support that is available or not available, and the amount of financial difficulties that they go through. Even many studies have noted that people from lower socioeconomic status have higher chance of getting to substance, which is what we commonly see in our setup also. So these are the few other factors, familial factors, which are responsible, I would say, apart from the individual factors. And also the community factors, the easy availability. I'm sure, Dr. Sunil, every other street that we go, we find a wine shop, we find people accessing it very easily. So unfortunately, the age sometimes being deceived and being taken. So these are the few challenges that we have from the community, and the cultural norms also. Like I said, in some of the culture, it is accepted. So for any function, marriage or any death anniversary celebrations, anything is associated with alcohol. So it has been mostly known as a fun factor. So these are the, things that come from the community. And now social media, lot of pro-social media advertisements, pro-social media messages towards substances, or any the hero worship who uses these kind of things and the style that has been followed. So there are many influence that come, and also the youngsters who pray for these kind of algorithms often become the
get into the substance.
Yeah.
See, are there any socioeconomic backgrounds which are more vulnerable for addictions? And also, does education matter in the sense being a postgraduate or a graduate, or does it have any kind of impact on becoming an addict, or doesn't become?
Not necessarily, Dr. Sunil, unfortunately, because whether you are from a higher socioeconomic strata or a lower socioeconomic strata, the usage, the problematic use, all are there. But help seeking differs. So people from maybe higher economic strata will be able to access support when they have distress, and that may be helpful for them to continue because there is a continuous engagement with the person by the treating team. So there are better results because of their engagements. But education again doesn't have much much connection with the substance use, whether from lower educated or a higher educated person, there is a problem of use. But the dropout from the education in very young age has high susceptibility to use. So high vulnerability to use or get into substance use.
Just explain this, what you said just now. Yeah.
Yeah. School dropout has found out to be one of the major challenges, which becomes one of the easy reasons for the children to get into substance use because of the lack of engagement. If there is a school supposed to be a protective factor, so that protective factor, when it is dissolved in very young age, where the children are generally not supervised in that age, or nor they are having any employment because of their age or skill set, they will not be in a highly engaged environment. So that becomes one of the vulnerability.
So whether somebody is highly educated, qualified, and has gone to good universities, or somebody has not gone to any colleges, when it comes to the addiction, it looks like it doesn't matter. Both of them are equally vulnerable, equally can get into addiction. So if somebody thinks that I'm very well aware of the consequences of addiction, so do you also see that as a problem, that people think that I know about alcohol, I'm very well informed, I can't be an addict, or I cannot get into addiction. Do you also see this kind of?
Yes, we do. And our challenge is with these people only. Okay. Because they think that they can control anything. That is where the biopsychosocial factors come into the picture. Because the brain that they know is different than what it actually
they have
when they are under the influence of substance. So they even if they claim that they know, they are aware, sometimes it is beyond their ability to control if they are not adequately motivated.
Okay. This addiction, when they're having, you beautifully explained to us how the culture, the family structure, and the background of the family can have an influence either positively or negatively about somebody becoming an addict or getting into addiction. But when somebody is already addicted, what are the negative effects? How do you see the impact on the family, parents or children? Please, share your experience. And
yeah, actually, it's a very important a piece of information in the sense that we do not give adequate emphasis to this population. So when it becomes an addiction, so addicted person becomes the primary care receiver. So, but here there are many other people also being affected. There are some young children or the adolescents who have got used to, got exposed to such environment. Maybe they would have started with a BD, which we say, or a cigarette, that we say as a gateway of all substances. So they would have just started with tobacco usage. So such children, we call them and we educate them. We also provide them with certain education pictures where it has impact. It impacts if it continues in a later stage. So that is a kind of psychoeducation that we provide. And we also talk to them if they have any other distress in terms of trauma or in terms of difficult scenarios which they find it difficult to handle. So according to the need, we intervene. Sometimes it may be the loss of attention of the family mother herself because of her engagement and her busy handling of other.
There is a role reversal of the mother. She is now the breadwinner, plus also the burden of this health.
Yeah. So in such circumstances, we educate the family member, the mother, or any other family member, significant member in the family, to give some emotional and kind of support.
Should children in this kind of a home environment stay at home, or they should get into boarding schools or go out of the house so that they're not in the toxic environment? What would be your suggestion?
So going to boarding school is not the solution. So they being in the family, because how long the boarding school can take care? End of the day, they have to come back and get adjusted to the system. By then, if the system is okay, then fine. But what if not? If they have not taken any help from any professionals and the system still exists. So the child would have just missed a few years, but will come back and get exposed to the same environment. So instead of that, the child being there, how healthily the child can cope with the system is something that we train and we teach. So,
okay. Yeah. And how does a spouse, deal with it? I think you were talking about NIMHANS having almost 10-bedded women de-addiction center where you're also treating women, though it is in terms of the percentage compared to the men. Women getting into substance abuse is much lesser, but still there are there. How should they deal with each other when, as a couple, when the other person is gotten into substance? What are the problems that they go through, and how to deal with them?
Actually, it is a strange thing that I'm going to explain here. When it is a woman who comes to the hospital, generally men do not come to stay.
Okay.
But if there is a male who is affected, their spouse will go and stay. So that is the societal challenge that we as women have. But women with substance use problem, their problems are slightly different. Whether they have any other caretaker, sometimes mother comes, sometimes sister comes, sometimes brother comes, sometimes son or daughter, they come. So when they come as a person who needs treatment, if the husband also needs treatment, then we club them together and provide treatment. Because if the woman is in the hospital, so somebody has to work back at home. So somebody has to provide the system some requirement that is there at home. So generally the other husband or other spouse takes care. So that is how the women with alcohol or other substance use are taken care by other family members. So that is one factor. The other factor is if they are coming together, we provide them treatment. Otherwise, if only the woman comes, then we have to assess them in a totally different way, because their problems, their circumstances, their reason, their vulnerabilities are slightly different than men. So accordingly, we provide intervention.
Can you little elaborate on, how different it is, because it's just one substance, which is alcohol or a drug. And men or women, we are human beings, we've got a body and we are consuming it and they've become dependent. Since you're talking from totally a different perspective of psychosocial context, how different it is when you see men with addiction and women with addiction.
Yeah. So when it comes to women with addiction, it starts little later in their life. So that is one observation, maybe after 25 or after 20s, which would have been introduced sometimes by the family member themselves. Maybe for a health reason, or maybe after delivery that they have to consume because of health reason again, or because of the severe distress that woman has undergone. Maybe loss of a husband, or deserted or separated, or any such life event which becomes the reason for the woman to trigger the usage. And that has been supported by generally by the known circle. For example, if a man walks and he goes to any wine shop, anybody can be a person whom he or she get introduced, and they may have a general talk and consume. But women, there will be specific people who would have introduced, who supply, and who also would be...
Because there is a barrier for a woman to go to a wine shop and take alcohol, where men, it's accepted.
So then it is generally known circle. So that is the second observation. The other part is when women start consuming, there is a concept called telescoping phenomena. So there is a tendency for women to absorb the alcohol faster, and they become faster addicted to the substance than men.
Oh.
Yeah, so that is the warning part also here. And which is why they become faster into the state of addiction, dependency. And there will be sudden dysfunction that takes place. So it becomes very obvious, which requires an attention by the family member or treating.
Is it because people, as society, we are so heavily dependent on women?
Maybe. Possibly, yes. Because when they become dysfunctional, so...
The entire family is disrupted, I mean, this is something which we see.
Yes.
If a man at home, if he falls sick, still the home functions. Okay. But if the women at home fall sick, the home is disrupted.
Yes.
Please.
Dependency is high on that,
Very
right?
high.
Yeah. So so when we this is the assessment that we do. So we understand what is the problem that they are facing. Then handling that situation sometimes helps the women in staying abstinent, or any alternative support or continuous engagement with them sometimes helps them to stay abstinent, which is sometimes challenging in the when we intervene with men, because they have many other factors, many other layers influencing their substance use.
Where do you see more complexity, men with addiction or women with addiction?
For us, it is same.
It is the same?
Yes.
Okay.
It's the same.
So, and women, you explained the various aspects of known people introducing, and then maybe starting off in a very close circle, and also the dysfunction setting in much quicker and probably very abruptly there. How is it different in men? How does this happen? And from a social context, please explain to us.
So, as I said, men generally start with tobacco, which may happen at the age of 10 to 13 year itself, which is a gateway of all other substance. So then by 16, 17 itself, they start getting introduced on a social drinking mode. So slowly it builds up in their 20s. And then it becomes, as you also mentioned, that sometimes they feel that it is good for them, and they feel good when they take it, and nothing happens to them. They know when to stop it. So that kind of attitude where they forget that brain has a different story altogether. So then slowly it becomes a part of their life. Then from social drinking to regular drinking, from regular drinking to it becomes everyday drinking, from everyday drinking then the tolerance level increases, so they take more alcohol to satisfy themselves. So then they get into the mode of harmful use, hazardous use, then addiction, then dependence. So the journey may be almost 6 to 7 years in larger population, but it can vary. Even if the problem is very severe, psychosocial problem is very severe, then it may have a faster process of addiction also. But slightly delayed because if it has started in very young age, there are high chances that they get into addiction in very young age. So the actual good functional period of their time is really been affected because of alcohol.
Because of alcohol.
Yes.
So in Cadabams, as you know, we've also we have a women de-addiction wing. But the type of clientele or people who come to us, we see a lot of young adults. Again, women, I'm talking about young adult females who are into mostly polysubstance abuse. Okay. So in a regular community, you being part of NIMHANS, where access is much, much wider and larger, what are the different substances that women with addiction come to you?
The same polysubstance is there in the people who come here also have been taking. And we also have young population coming because these days, so maybe the stigma or the acceptability towards treatment has been increasing. So we have that population also coming. Alcohol is the major substance among mid-age and above. But other substances like cannabis or opioids, and even hard substances like cocaine, they are also being
quite prevalent.
Yes.
And adults do get into that. Yes. Recently, when I was meeting a family, one of the parent was saying that my husband is very, very strict. That's why my child did not have the freedom of what he wanted to do, and that's why he got into substance. And completely to contrast this, few months back, one more family, doctor, my husband is not at all involved in my child's care. He's very, very lenient. He's not strict at all. Since he's very, very lenient, my child had access to these drugs and he got in. I mean, this brought me a question as to, does this matter at all? That, and then I think when we have an expert like you, I'm very curious to know as to what are those parenting skills or parenting styles which are protective and which can help child, and what are those parenting styles which can kind of push an individual into the substances?
It's very hard to say because, of course, we when it comes to the parenting pattern, we generally say there are main 4 categories: authoritative parenting, authoritarian parenting, permissive parenting, neglectful parenting. These are the 4 categories.
Authoritative, authoritarian, okay, and permissive, neglected. Okay.
Yeah.
So what is it?
Yeah.
So very interesting.
Yes. Authoritarian parenting is generally whom you have first quoted, that kind of parenting style where everything what the parent says, the whole other system has to listen. Children, spouse, or if they are elderly parents, also all have to listen. So their decision is final, which is again very suffocating, and where other personalities do not have much exposure to say anything or express anything. So authoritarian is something which is found to be more healthier, because where the discussions happen between parent and child, where things and decisions are taken mutually, where the people of other members of the family also have a say. So this seems to be a healthier parenting pattern in a context.
Still there is authority, but there is a discussion.
Yes. Say. The other pattern is permissive parenting. The second example that you gave, where no, not exactly that. The permissive parenting, where whatever the child says becomes the final. So child has all the right to discuss, design, plan, decide, and everybody else have a acceptance of that. So when it becomes permissive parenting, where the child is not really completely experienced in taking certain decisions in life, it can lead to certain problems. And even parents also thinking that, we should not control the child, we should give the lenience, we should give the freedom. When there is no control, the child doesn't know the boundaries. So sometimes there is a chance for slip. And uninvolved parenting is somebody who is not involved in any of the child's developmental phases. So when that is the situation, each one, like a vertical, they grow, not knowing how to build themselves up. So that again leads to lack of guidance, lack of support, lack of a kind of support by the other system in the family. So the difficulty the child faces.
Is there an influence of this type of parenting to somebody getting into?
Yes. As per the studies or as per the understanding itself, we can make out that authoritative, neglectful or permissive parenting have a high probability of having children with substance use, and many other sometimes it may be a conduct disorder, sometimes it may be other behavioral issues. So all these problems can be the repercussion of this parenting. But however, having said that, there is no hard and fast rule that this parenting works and this parenting doesn't work. So many a times mix and match.
That's a big relief to most of the parents because, everybody, today's world, there is so much of stress. People talk about and they say this is the type of parenting which you should. I think we are all in fix. Thank you so much. That's so much of a reassurance for us. Yeah.
So we have to mix and match all the different kinds of parenting styles because sometimes being very strict will work with the child when as the situation warrants, and being very permissive at sometimes might work where you have to get the things done, let go and take something from the child. So but overall the continuous journey with the child, continuously making sure that the child mental health is also taken care of, developmental phases also being given adequate space, and the parents are also being there together, finally works well in looking after the children. But therefore,
how important is it, this parenting styles, when you are treating a person with addiction? How much of importance you give, and what do you do?
So it helps us. I mean, actually we use them in two contexts. One, in the past, whatever that they have experienced, they have the exposure to talk and also express themselves. So whatever the trauma or the distress that they have gone through, so we discuss and we also come to certain conclusions based on the past experiences. So that can help them to not carry it forward. So the second part is how we can help the families to balance. So when we try to educate this to the family members, so the environment at the family, it becomes easier for the person to recover. So in the context of recovery, we try to use this
try and approach. Do an assessment and help them change the, of course, parenting, it is already done, at least the environment, So when you're addressing these people, these parenting styles, I think something which stuck to me is there is a communication, that as parent we communicate with the child or child communicates with a parent. From a psychiatric social work context and addiction, okay, how important is this communication? Or again, are there any different types of styles of communication that is there which can influence?
So communication plays an important role in the context of addiction.
His parents and his family, his educational background, and so much has to be done. So when you are exploring these areas, how do you address them? I mean, it is so diverse. One of the examples is the parenting styles. There is no one parenting style which is good and which is acceptable. So when you have such diverse reasons, how do you help them?
Yeah. So we have something called a short term and long term. When it comes to problem also, we assess that way. When we set the goals also, we assess that way. We plan that way. And when we do intervention also, we do that way. So what is the immediate need? That we give more importance. It may be in any of these categories. It may be the individual-based problem or family-based problem. In family, it may be communication. It may be any other boundary issues, or it may be the coping problems, or any of these things. So where exactly is the major problem which needs to be handled immediately? So we give importance to that. If there are certain problems which are there, but they are not going to extensively trouble the existing problem, then we may not touch at that point, because we also have limited time. We also have their availability also such that we cannot keep them for longer. So whatever is the immediate need, we handle that. So then as they come in follow-up, or when we associate with them in a longer term, then we deal with all these problems, because for us, their relapses also is an issue. Their process of recovery is also important to us. So we handle it according to the need of village.
This addiction, as you've broadly explained, there is an influence of society or a group, a group of individuals who is having an influence or pushing an individual into substance, while treating, okay, do you also take that group into consideration, or do you also use the same influence of group? One is individual interventions, family interventions, and group interventions. If you could little elaborate on each of this as to what happens and what is done, it would be very helpful.
Okay. So when we talk to individual, we mainly focus on the goals that has led to the current problem. So which includes sometimes motivational interviewing and motivational based intervention, motivation enhancement therapy that we call. If the person will be helped by this particular intervention, we provide that. Otherwise, we also have something called as relapse prevention therapy. So that is most commonly used intervention for the individual based intervention. So which has certain aspects of how to handle high risk situations, how to handle the crisis, how to be assertive, and how to extend their usage. So how to treat the lapses, how to take the help, how to seek the help. So there are many strategies that we follow when we talk to the individual. So when it comes to groups, first of all, we have to take their consent if they are okay to come and discuss their issues in the group, and where there are other individuals also present. So it is done in a setup where with everybody's consent that they come in, and then a group worker, a social worker who will be there to navigate the group, and then on a particular topic for that particular day, the group work is being conducted. Even in groups, sometimes we have psychoeducational groups where we will generally ask them what is the understanding, what is their knowledge about substance use. Most of the time there will be possibility for myths and misconceptions. So we handle that part in one session. So sometimes there are people who also have certain personality related problems. So then we also talk about social skills or some other skills that they really, and that particular group, some kind of homogeneity we would like to bring when we conduct these groups. So based on such needs, our therapeutic intervention takes place. We found it to be very effective because there are the people feel that not only me, others also have the same problems. When they are together in a ward, they just talk in a very generic term. They may not be even going too intense into the problems that they have. And also when the group worker tries to bring it out from them, it makes it more therapeutic as a whole. And then there is a learning that is happening, group learning that is happening. There is a network that is building. There is like-minded that is getting built. And it all puts together leads to one therapeutic engagement.
Wonderful.
Yeah. So family intervention specifically that you have asked, we go with therapeutic way. Sometimes we have family therapy unit that gets involved because it is an extensive time consuming and intense based intervention. So that is one referrals that we do. Otherwise, when we as psychiatric social workers commonly deal, which includes various problems that are involved. It may be, as you mentioned, any family dynamics in the form of communication, in the form of problem solving, in the form of financial issues, in the form of coping things. So any of these factors which found to be most difficult to handle, and it may be expressed emotions that exist in the family system. Maybe family is just critical. Even if he tries to stay abstinent, the family may not be supportive. So what is this criticality? What is this warm regard? What is the difference between criticality and positivity? So this is the few things that we teach the family members. So it becomes easier for the family to also to deal, and it can help in prevention of relapse. Okay. Expressed emotion is an expression by the family members or by the individual without being aware of it most of the time. Or there is a expected gain by doing that particular behavior. So when it is done without knowing, there is a possibility of changing it to some extent. But when it is done intentionally, then it becomes little difficult to handle the situation. More specifically, for example, there is an expressed emotion that is called as criticality. So any family member, for any situation, any behavior of an individual, behavior of a child, they will just talk something very critical, which is part of their daily communication, which they are not aware that they are doing it for a reason, that the reason is to change the behavior or to change the person's or the way the mother or father thinks. But it has an impact on the child. The impact is such that the child may start believing that the person is like that, you are useless, you are not good in this. So the child may start believing in such things, and that may create a lot of psychological impact in the child in the later life.
Which can lead to addiction and...
Yes, many such problems. So sometimes intentionally it is being done. So when it is done in an intention that to hurt or to be critical, sometimes it has a very expected behavior of child going into abusive pattern, which includes addiction. So it is very important for us to understand how far it is been part of their lifestyle or part of their communication, or how far it is in an intention that to harm someone psychologically or emotionally is something that is very important for us to understand. So generally criticality and being cold, like negative kind of connotation. So this is all associated with negative expressed emotions. Positive regard, positivity, all these are known as positive expressed emotions. So to what extent it is there in the family system and to what extent it has impacted the individual helps us to provide the intervention.
So what you're saying is these being critical or kind of very cold, not involved or maybe over involved with the children, not necessarily can cause addiction or lead to addiction, but when there is an addiction, this becomes extremely important for you to help.
Yes. Because they are not directly geared towards a person's addiction, but they have a role to play. So that is very important for us to understand as therapists.
Great. Person with addiction can be in a remote place where there is no medical facilities or very limited medical facilities that is available to him being in a city like Bangalore. So for a person with addiction, what are all the treatment settings that we have and when to seek what kind of treatment settings?
Okay. Generally, what we see in an urban setup is that we have hospitals being available, tertiary care center like NIMHANS being available, but and de-addiction centers that are available. But these facilities may not be there in rural areas or semi-urban areas. What we are educating people is that there are primary health centers. So primary health centers are equipped to treat the basic health problems of people who have addiction.
Primary health center, you're equating, not everybody might go to a government settings. So primary health center meaning a clinic.
Clinic.
Okay.
Yes. Any private clinic or a government setup where the immediate health needs, such as if they have severe gastric related problems or they have withdrawal complications. So simple withdrawal complications, which can be really treated in such centers. But the doctors always suggest them to either stop or reduce and stop or take treatment and stop. So these suggestions would have been given naturally by any treating facility. But it is for the individual and family to actually take it forward and then to come and see a specialist. So that part is somewhere that we are finding it as a treatment gap. So this is one aspect where clinics or hospitals can treat these people. The other setup are de-addiction centers, where the person can be kept for 1 month to 3 months to even 6 months as per the need, where they are being given treatment of various kinds. Other factor is the now actually government of India or the central government has brought many many programs under National Action Plan for Drug Demand Reduction, where NGOs can actually support de-addictions for de-addiction in the form of their existing program. They can add de-addiction as one of the programs. They are given a small support to run these centers. So if you see hospitals, tertiary care or big hospitals in urban cities, then hospitals and clinics or primary health centers in rural areas, and de-addiction centers and NGOs. So these are the 4 community and health and community-based sectors that are available
where
for anybody.
people can seek help when they have.
Yes.
So today we have had a wonderful conversation about addiction. Addiction not as an illness that one individual is going through. Addiction as a problem that a family, as society, as community that we go through, and impact of all of it on the individual, in both helping the individual overcome the addiction or pushing the individual into getting addiction, and how as an individual he can take the same help of the community, family, parents, spouse to come out of the problem. So Dr. Shreedevi today explained to us beautifully how this helps, and one wonderful thing as a message that we got today is, wherever you are and whichever setting that you are seeking help from, never miss to meet a psychiatric social worker who has in-depth understanding of so many areas of one's life, which is very, very important to recover. Thank you so much, Dr. Shreedevi, on behalf of Cadabams, making time and, being with us and educating and helping us understand the psychiatric social work in the context of addiction so well. Thank you so much.
Thank you. It's my privilege and honor. Thank you. My pleasure. Thanks.